I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It, episode 67. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
As a chiropractor, patients come to us. The number one reason we see patients is because of pain. And patients come in and say, Doc, I've got neck pain, back pain, shoulder pain, I've got headaches, I've got numbness, sciatic pain. And it always amazes me that when people will call up and say, Doc, I've got right sciatic pain, shooting pain down my leg. Now, a friend of mine came to you and she had left sciatic pain, and you did great work on her. Do you work on right sciatic pain? And my answer is always, yeah, and I try not to chuckle, of course, because, again, there's no such thing as a stupid question. But I'm always fascinated that people may not totally understand chiropractic. I mean, of course, I've been in practice 34 years. 34 years ago, we were the voodoo doctors with the horns, and now we're teaching in medical schools. We consult, obviously, we have radio shows and TV shows. So it's really come a long way from where it was because it was always working. It always had an amazing scientific basis. It's just that now the public is finally catching up to it. So people always want to say, Dr. Joe, what can I do to get out of pain? And a lot of times we get questions on our website, drjoe.com. By the way, if you have questions, you can always send them to the website. And people say, what can I do? What are the steps I can take? Now, that being said, if you ask the question, I'm going to assume that you're willing to take some steps. I know I did a show a couple of weeks ago and people want to lose weight. What pill can I take to lose weight? I said, well, it's a lot more than just taking a pill. So we're going to talk about rules to a pain-free life. Things that you can do, but you got to do them in order to get out of pain. Now, these are things that you can do. It may not always solve the problem. Sometimes you need chiropractic care. Sometimes you need surgery. Sometimes you need injections. But this is what I want you to do as part of your lifestyle to help reduce the pain. Pain is a warning sign. Pain is telling you that something's wrong. The analogy, of course, is very simple. If the flashing light on your dashboard comes on, you pull over to the side of the road and you call a mechanic and you say, something's wrong with my car. I got this warning light. I've got to get it fixed. I want you to think about pain as a warning sign. Now, pain can be good. It's telling you that there's something wrong. Just like that flashing light, don't ignore it. Every day in our practices, patients come in, Doc, I've been meaning to come see you for 2 years, 5 years, 10 years, 20 years. I just haven't had time to do it. Well, now it got worse, didn't it? Yeah, it did. Okay, now it's going to be harder to fix. And maybe may not be able to be fixed at 100%. So take that pain as a warning sign that there's something wrong. So once you get to the root of the problem, that's what we're trying to do, get to the cause of your problem and not just treat the symptoms. And many times patients come in, and maybe it's a big accident, like a car accident. It's real obvious. Get in a car accident, my neck hurts, my back hurts, I hit my head on the dashboard. We know where the pain is coming from. But then I look back at their past. Past always comes to haunt you, doesn't it? We look at their past, and sure enough, they do a lot of bad foods. They do a lot of acid foods, alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener. They don't drink enough water. They don't get enough nutrients in their body. They're eating bad foods, so they're not eating good foods. And so now we have to sit down and say, okay, what are we going to do to fix this as quickly as possible? Patients in our office, we have a goal. And the goal that we have is get you well as quickly as possible. Not just out of pain, but well. Because remember, 90% of your nerves don't feel pain. You don't feel your blood pressure, your spleen, your kidneys, your earwax, your toenails, your hair grow, all controlled by nerves. So you can have a pinched nerve and not know it. And that nerve is going to affect an organ. Then finally, when the pain shows up, people say, well, Dr. Joe, I got pain. I just got this neck pain last week when I was gardening. We take an x-ray or an MRI, and we can see that there's advanced arthritis. Arthritis, to even show up on an x-ray, takes 10 years. So you injure yourself, it's not going to show up on an x-ray as arthritis for 10 years. So what does that mean? Problem's been there for a long time. If I have advanced arthritis, it's been there for decades. Yeah, but it just started hurting. Let's go back again. 90% of the nerves don't feel pain. You can have a pinched nerve and not know it. So remember, if you have an injury, you need to get it fixed. Of course, you got to talk about diet. I mean, it's probably the easiest thing that you can do because you have control over this. No one is forcing you to eat anything good or bad. But here's the trick to eating well. Get the bad food out of the house. That's it. It's a very simple rule. Because if bad food is in the house, you're likely going to eat it. I know years ago, I tell this story often, a patient of mine, elderly woman, she made these chocolate chip cookies for me, and she was so grateful that she had to walk with a walker, and she thought it was the end of her life, and now she's walking again, and she's able to go shopping and have a life again, and so she brings me in some chocolate chip cookies. And she says, Dr. Joe, I can't thank you enough for everything you and your staff have done for me, and here's some chocolate chip cookies. And I said something really stupid. I know, imagine had a man saying something stupid. I said, really, what's in them? And she goes, oh, well, you know, it's organic wheat, and it's flour, and it's butter, and it's eggs. And then I said, something stupid, my lesson of life here. Oh, I don't eat dairy products, so I can't eat these. And this woman's face just sunk. And I thought, you idiot. Why didn't you say 2 words and walk away? What 2 words? Thank you. This is wonderful. It wasn't the cookies that was the treat. It was the fact that she took time out of her day and thought about us to make the cookies. So here I ruined it for me. I ruined it for her. All I had to do is say thank you, take them away. Would have been fine. So if the bad foods are in the house, you're going to eat them. And then another time, go back to another story, somebody did make me vegan cookies, and I had them in my pantry, and I'm sitting there in my keeping room, I'm watching TV, and I could have sworn they were calling me. Joey, Joey. And I'm thinking, I got to get these out of the house. And so I have a stream in my backyard. I took the cookies and literally threw them into the stream because I knew that if they were in the house, I would get them. And many people will follow this. I'm going to throw them away. And you don't have to raise your hand, but you could admit it. Have you ever gone into the trash and dug them out and then ate them, whatever they are? Yeah. Okay. That's how bad these foods are because they're so addicting. They stimulate the dopamine receptor sites in your nucleus accumbens in your brain, and you get high. So probably nothing more culturally driven, more society driven than food, right? You go to a wedding, you eat. You go to a funeral, you eat. You go to a baptism, you eat. You go to a party, you eat. You go on a date, you eat. You're alone, you eat. It's 5 o'clock, you have to eat. You need to reset your brain as to what eating is. You eat for nutrition, not for the pleasure of the food. Now, there's tons of pleasurable foods that are high in nutrition. So that's what I want to teach you, is you can get pleasure out of your foods and eat the right things. So nothing's going to affect your health more than your diet. Not exercise, not supplements, not stress management, not chiropractic care. Well, chiropractic care in addition to food, I should say, is going to affect your health more than what you eat, things that you have control over. So that's a big thing. Nothing. I see people that work out like crazy come to us as patients. I've got neck pain, I've got back pain, I've got acid reflux, I've got heartburn, I've got diarrhea because they have a bad diet. I'm a bodybuilder, I need to eat protein. Not true. We all need to eat protein, but most people get way too much protein. When I see these bodybuilders eating every 3 hours, having a piece of chicken, and, skinless chicken, and they're going to have chicken, and they're going to have their protein drinks, and their whey protein, and their raw eggs, or their cooked eggs, totally unnecessary, and in fact, very dangerous. Your body can only process about 8% of its total caloric intake as protein. Anything beyond that has to go through your liver and your kidneys and gets wasted. And years ago, when I got in practice, I had very few patients come to me with kidney disease. Very, very seldom. Now I see it every couple times a week, I should say. Kidney disease, stage 4 kidney failure. What's going on? What changed in 30 years? A lot. And what people are putting in their body has a direct impact on the stress you're putting on your organs. So you can't handle these mega doses of protein. It's impossible. Whoever thought that was a good idea, I'd like to meet them and discuss it with them and say, what are you, crazy? You can't handle that amount of protein. So once again, nothing has a bigger impact on your health and your lifestyle and your emotional stability and your job performance and your relationship performance than what you eat. So why not eat good food? You have to eat anyway. You might as well eat good foods. So there's a couple of things I want you to consider when it comes to putting together a good diet. Number one, stay away from processed foods. And a good rule is this: if it has a label on it, don't eat it. I know that's a little extreme. All right, so I'll negotiate on that one. If you can't pronounce an ingredient, don't eat it. Processed food's not good. And even if you're a vegan, I'm a vegan, I've been a vegan for 32 years. But even if you're a vegan, there's a lot of processed vegan foods that are really junk. They have these hamburger patties made out of textured soy protein. Do they taste good? Yeah, they do taste good. Absolutely. However, they're not good for you. They taste like meat. They're fun. They're easy. They're convenient. They're cheap. But textured soy protein, when you do the texturing, the process of the soy protein, you free up something called glutamic acid. And a couple of weeks ago, I did a show on glutamic acid, Foods That Heal, I think I called it. And I really got off on a tangent on glutamic acid. And glutamic acid, when it's with other amino acids, is good for you. a large amount of isolated glutamic acid can cause your your nerve fibers to fire off and increase your pain. That's why many times when people eat Chinese food, monosodium glutamate, glutamic acid, they'll get a headache. Because the cells have what's called glutamic receptor sites. The glutamic acid hooks into the cell, causes the cell to fire off, and you start getting pain. You didn't have the pain before the monosodium glutamate. You had it afterwards. What caused it? Well, the monosodium glutamate. So it's not a structural issue. Chiropractically, of course, we always look at the spine to see if there's any structural issues or any joint. But there can be a chemical issue as well. And that's why in our offices, we do a nutrition evaluation with all of our patients. And the reason we do that is because we want to get the patient well as quickly as possible. If you come to us with headaches and you've got a pinched nerve in your neck, we can give you the best chiropractic care in the world. But if you're sensitive to glutamic acid and you're doing monosodium glutamate, which by the way has over 40 different names, autolyzed yeast, hydrolyzed vegetable protein, natural flavors could be monosodium glutamate, and you're doing all these glutamic acid, foods high in glutamic acid, firing off the glutamic receptor sites, causing the headaches. Well, I went to the chiropractor, it didn't help. I went to the neurologist, and it didn't help. I went to the orthopedist, it didn't help. Physical therapy didn't do anything for me. It probably did, but you didn't remove the cause. And that's why a lot of doctors will even send their patients to us just to do a nutritional evaluation. Chiropractors, medical doctors, hospitals will send patients to us and say, do a nutritional evaluation on this person. Let's see if we can get to the cause of the problem. So processed food is a big issue, and a lot of processed foods have monosodium glutamate in it, and that can cause pain. Your diet should consist mostly of fruits and vegetables, and then some nuts and seeds. Now, with nuts and seeds, yeah, they're very good. They're high in magnesium. They're high in a lot of nutrients. However, I can't eat a lot of nuts and seeds because I gain weight. And I find that as we get older, that becomes an issue. A lot of my friends will say that, Doc, I'm eating exactly what you tell me to. And I don't understand it. I'm not losing any weight. Let's go through your diet again. All right, you're doing nuts and seeds every day, almond butter, cashew butter. Let's cut out the nuts and seeds and see what happens. And usually in a few days, they start to lose weight. Doc, you were right. So nuts and seeds are good, but very, very moderate. Fruits and vegetables, mostly vegetables, some fruit. Be careful with, if you're going to eat animal products, try not to eat animal products that are farm-raised. Okay? You want to have, farm-raised, they're all farm-raised in theory. But you want to make sure it's organic and not conventional. Because organic meats have lower omega-6 fatty acids in them and higher omega-3 fatty acids in them. Omega-3 fatty acids are necessary for anti-inflammatory control, inflammation control, and pain management. So if you're eating a lot of conventionally raised meats, corn raised, soy raised, chickens, meat, corn, chicken, beef, pigs, what's going to happen is you're going to have a lot of omega-6 fatty acids, which is going to increase your inflammation, which is going to increase your pain. Wow. You mean to tell me, Doc, that I love my hamburgers, I love my pork chops, I love my chicken, I love my eggs. I get it. That could be contributing to a pain-ridden lifestyle. And we're talking about a pain-free lifestyle today. So if you're going to eat animal products, organic only. Now, the less you eat, the better. But if you're going to eat them, I recommend you do organic. Don't overeat. Your stomach is only this big. Your stomach is only the size of your fist. What happens is when you put more food than this, which most people eat in a meal, into your stomach has to expand. It's a muscle. It stretches. And if the stomach stretches too much, it can't do its job. Imagine your stomach like a Ziploc bag, and you fill it 3/4 of the way full with water. You zip it up. You can squish that water around, right? Well, that's how the acids in your stomach, pepsin and pepsinogen, mix with the food and come in contact with proteins and dissolve the proteins into something called amino acids. If your stomach is too full, that Ziploc bag is you can't squish things around, and so the stomach can't mix and churn the meat or anything in there with the hydrochloric acid, which activates pepsin and pepsinogen, so it can't break down the proteins. And so now the food sits in your stomach for too long and it essentially rots. When it rots, it gives off something called lactic acids. Then the food passes from your stomach into your small intestine, partially digested, where it causes another inflammatory reaction because the intestine can't do the stomach's job. So you have this inflammatory reaction going on in your small intestine now, which then increases your pain. So even if you're eating organically grown salad every single day, what's going to happen is eating too much of it is going to prevent it from properly being digested. Now, salad's a lot easier to digest than steak, so if you overeat on things like bad food, it's even worse than overeating on good food. So don't overeat. Be careful. It takes 20 minutes to get the message from your stomach to your brain. So here's my rule. If you're an overeater, like I used to be, ruin your appetite. I want you to have a snack about 20 minutes before your meal. Now, we talked about nuts and seeds can put on weight. Take a handful of nuts. That's not going to do it. It's not going to put on a lot of weight. Take a handful of nuts and eat it 20 minutes before your meal. Almonds, walnuts, pecans, pistachios, not peanuts. Peanuts are not nuts, they're legumes. They usually have something called mycotoxin, which is a fungus that can cause allergic reactions, so stay away from peanuts. Handful of nuts, just one handful, before your meal. You'll be amazed how much less you eat. It's one of the tricks I teach people when I do my weight loss seminars. So be careful with that, okay? If you're overeating, you got to ruin your appetite, and that's going to solve the problem. Many times, when I have this problem, if I eat, my stomach is bloated and full, but it hurts, but I'm still hungry, I still want to eat. My stomach is pushed up against my diaphragm. And when that happens, I'm not getting the messages from my brain to my hypothalamus by way of a hormone called leptin. So my hypothalamus isn't getting the message that I'm full and I want to keep eating, even though my stomach is full and it hurts. So if you have acid reflux, heartburn, burping, gas, bloating, chances are you need to come see us, and we can pull your stomach down away from the diaphragm, actually adjust your stomach. About 85% of the patients we see have some form of this condition. So you may come in with neck pain and back pain, maybe you're in a car accident, sports injury, and you finally come to us for chiropractic care, and we check the stomach, 85% of the patients have it. So we fix that as well because you digest your food, which helps reduce pain, which helps the chiropractic treatments work more effectively. See how cool that is? So it's not just the spine we work on the diet, we work on the spine, we work on the digestive system. Those are the three things all our patients get checked, and we want to make sure we get all three working because that's how you're going to get well fast. Our goal is get you well fast. We love seeing your pretty face, but we want to get you out of there as quickly as possible. Follow our advice. If you come to see us or any doctor, follow their advice. Because sometimes you'll come in and get a few adjustments, feel great, and say, I'm done, doc, you guys are amazing, I'm done. No, you're not. You're out of pain, but we still have to restructure the spine to stop it from reoccurring. And inevitably, those patients who think they know more than we do, and it's about 2% of my patients, they know more than I do, or my other doctors, and they come back in. 2 weeks, 5 weeks, 10 weeks, 5 years. Doc, you were right. Maybe it's 5, 10 years later, we take a new x-ray, sure enough, the spine's all deteriorated. Oh my God, it's all deteriorated. I know, I told you it was going to be deteriorated. I didn't lie to you. And I used to get all upset over it. Now it's like, hey, it's your call, man. Whatever you decide to do is up to you. But follow our advice. So if you want to come see us, by the way, we have offices in the Atlanta area, Marietta, Duluth, and Stockbridge. We would love to be your doctors. So if you'd like to make an appointment, go to my website, drjoe.com, D-R-J-O-E, real simple, drjoe.com. You can do it right online. Pretty cool stuff. Now, if you're old school, you can always give us a call. The phone number's on the website. And we're more than happy to set you up a time to come see us. Again, we have offices Marietta, Duluth, and Stockbridge. And my doctors will do an evaluation. And if you have x-rays or an MRI and you want to bring them to us, we'll review them with you, no charge. And we'll go over the x-rays or the MRI with you and say, okay, this is what we found. What next? Is this a chiropractic case? Is it a surgical case? Is it a physical therapy case? And we'll help you decide that. So if you want to come see us, and I think you should, by the way, because most people right now listening are suffering needlessly. Neck pain, back pain, shoulder pain, numbness, tingling, can't sleep, acid reflux, heartburn, gas, bloating. Why suffer? Why not fix it? Biggest complaint I get is, why didn't I do this sooner? I hear it every single day. Doc, why didn't I come see you sooner? Of course, it's a rhetorical question. I don't know that answer. But stop suffering. Go to my website, drjoe.com, for you, your friends, your family, and your kids. If children have a straight spine, they grow straight. If they're crooked, they grow crooked. It's a lot easier. So drjoe.com. So we're talking today about living the pain-free lifestyle, which is really kind of cool. Eat at the right time. Now, this is important. In a perfect world, you're going to eat no more than 12 hours a day. Not continuously, of course. But I want you to pick 12 hours. Now, it's pretty simple. If you wake up at 6 o'clock in the morning, have your last meal 6 o'clock at night. Then I want you to fast for 12 hours. It's called intermittent fasting. It's a new buzzword. It's pretty cool. Now, the reason I want you to do this is it takes 8 hours to digest a meal on average. So you're going to have a hamburger at night, or you're going to have a tofu sandwich. I don't know what it is. 8 hours later, that food is digested from your stomach into your small intestine if you're healthy. Then the food, it gets broken down and passed out. If you keep eating every 8 hours, you're constantly digesting food. If you skip time after 8 hours, every hour that goes by, you're burning fat. So in a perfect world, you're only going to eat in a 12-hour window. And that's not hard to do. Wake up, decide when you're going to have breakfast, decide when you're going to have dinner, and the rest of the time you're going to sleep and enjoy your life and have fun. Now, that being said, you can take this to another level. And with my chronic pain patients, I may have them do something a little more dramatic, or if you want to lose weight, a little more dramatic, or if you just want to be healthy, eat within an 8-hour period. Now, that's a little trickier. I'm not going to lie to you. That's a little tough. So what you do is you eat breakfast and lunch and skip dinner, or skip breakfast and have lunch and dinner. But try to eat within a certain amount of time, and you'll be amazed. A lot of people say, well, Doc, I've done everything. I've done the programs to lose weight. I've gone there. I paid for it. I've had meals delivered to my house. I've done what you said. I'm just stuck. Okay, let's start doing some intermittent fasting. Let's skip a meal twice a week, breakfast or dinner. Okay, how do we do? Wow, Doc, it really jump-started my weight loss again. I feel great. So it's a really neat thing. Number one consumer of energy we have as humans is romance. Number two consumer of energy is digestion. So most of us are wasting a lot of time and energy on digestion, and the body can use that energy to heal. And that's how we're going for a pain-free lifestyle. So if you really want to get the pain-free lifestyle, these are certain things you have to do. And then if you're doing everything right, you're still having pain, come see us. We have chiropractic offices in Marietta, Duluth, and Stockbridge in the Atlanta area. We'd love to be your doctors. Because chiropractic care tries to get to the cause of the problem, not just treat the symptoms. Now, if you're not a case that we can handle, maybe it's something that's out of our scope of practice, we may send you to a neurosurgeon. We may send you to a vascular surgeon. We may send you to an orthopedist, maybe a pain management specialist. I'm board certified in pain management. I think I'm the only chiropractor in my state who's board certified in pain management. So a lot of medical clinics will send their patients to me because we're all, diplomates in pain management and say, Doc, we're lost, man. We don't know what else to do with this guy. We gave him 3 injections in his spine. You can only get 3 in one area in a lifetime, by the way, in theory. And we gave him 3 injections. He's not getting any better. We're stuck, man. You take it over. Okay. Surgeons will send us patients and say, see if you can get him healthy before we put him into surgery because I want to make sure we have a good success rate. And that's really important too because doctors are graded on their success rate, especially surgeons. And so they want to have a high success rate. How do they do it? Get the person healthy going into surgery and keep them healthy after they come out of surgery. I'm not against surgery. I'm not against drugs. I'm not against whatever you need to get well. If you need it, keyword there is need. If there's other ways around it, if there's a natural way to control your pain or get your body well, that's what the team of doctors I work with are looking for. What's the best treatment for you? Maybe it's our clinic, maybe it's not. That's why we review x-rays at no charge. Or MRIs. Bring them in, we'll go over it with you. Say, you know what? Nope, you need surgery or you need whatever. So stop suffering, get well. Make sure you have enough fluid in your body. That's really important. Most of us are dehydrated. If we look at statistically, everyone listening right now statistically is dehydrated. Because when you were a kid, there was a part of your brain that controls hunger and a part of your brain that controls thirst. And as you get older, those two parts of the brain grow together. And so once you're a toddler on up, you have a tough time distinguishing between hunger and thirst. So many times when you're hungry, you're not hungry, you're thirsty. And if you're thirsty, the body is starting to dry up, so to speak, put it simple, and that can cause the nerves to fire faster than they're supposed to and cause pain. So it's really important that you consider that perhaps I'm simply dehydrated. Maybe that's why I have these headaches. Maybe that's why I'm constipated. Constipation can cause headaches, which can cause pain. You need the fluid in your system. So make sure you're drinking enough fluid. How much fluid? 6-8 glasses a day is probably a good amount. Everybody's a little different. A good way to judge is this. When you pee, the pee should be clear, and it shouldn't have an odor to it. And if the pee is clear, well, you probably drink enough water. If it's not, unless you're taking B vitamins, then you have an issue. Speaking of vitamins, you have to make sure, I'm going to cover that next, you have to make sure you're having the right amount of nutrients in your body. So the minimum amount of nutrients you need to take every day is Dr. Joe's Super Greens and Dr. Joe's Essential Source. They're 2 powders. They taste great. I have them at least once a day. If I have a busy day, if I have a couple of radio shows, TV shows, I got a bunch of lectures, I got a hot date, I'm going hiking, I'll take a double dose, 1 in the morning, 1 in the evening. So the Super Greens and Essential Source, minimum amount of nutrients you need every day. And coming up, I'm going to talk about other supplements that you want to take as well to help maintain pain and reduce inflammation. I'm going to talk about that because that's really important. Now, if you have pain, consider coming to see us. Because a pinched nerve, a bone out of place, could be any bone, the spine, the wrist, the knee, the ankle, the skull. If bones move out of place, they can fire off pain nerves, and that can hurt. And that's why so many people go to chiropractors and get chiropractic care for pain management. And it's extremely successful in most cases when the patient does what we say. I've had a patient, it was about a year or so ago now. He called up and he said, well, I was there once and it didn't help. I'm not going back. I said, we're not going to fix you. You're 65 years old. We're not going to fix you in one visit. We're not that good. I said, the guy who did that wore sandals. That was 2,000 years ago. It takes me a little longer than that. And he says, well, I don't feel like I want to come back. Okay, well, guess what? A few months later, he calls us up. Will you take me back as a patient? Yes, we will. He comes back in. He says, you were right. I just thought, one visit was going to fix it. No, nobody's that good. It's going to take more than that. So if you want to make an appointment to come see us, go to my website, drjoe.com. We accept most insurances, car accidents, sports injuries, Medicare. If you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So stop waiting, stop suffering needlessly. Go to the website, drjoe.com. I'm Dr. Joe Esposito. Thanks so much. Tell your friends about the show. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.